طيب السلام عليكم. My name is Abdullah Otaibi, and I'm a second year student. And inshallah, I will be giving you the anatomy review questions for the GIT block. And yes, that's it. طيب. So this is the plan this is what we're going to do. So we're going to have some questions about the oral cavity and the pharynx, esophagus and stomach, anterior abdominal wall, and peritoneum. The other three lectures, which are the small intestine and the pancreas, large intestine, liver and biliary apparatus, my friend Faisal is going to give you those three lectures, and the questions for those three lectures. Is everything clear? تمام. So let us just start with the first question. This is the first question, and should I read it, or do you guys want to read the questions and answer? Or do you just want to? Okay. So I'm gonna read the question. You guys just write in the chat what do you think the answer is? A patient is unable to taste a piece of sugar placed on the anterior part of the tongue. Which cranial nerve is most likely to have a lesion?
D,
Okay, so why do you think it's D?
because the trigeminal nerve is what supplies the sense of taste to the anterior two-thirds of the tongue.
Is it taste or is it like general
Oh,
sensation?
sorry, yeah, trigeminal was general sensation, while facial nerve was for taste.
Okay, so yeah, that's great. So there's this, so I'm gonna show you this slide. So there's this nerve which is called the chorda tympani, I think. This is how you pronounce it, but you can see it right here. Tamam. This nerve is a part of the facial nerve, tamam. So this nerve innervates the anterior two-thirds of the anterior what is happening? Anterior parts of the tongue, the anterior two-thirds, tamam. And the posterior one-third is is innervated by the glossopharyngeal nerve, which is the ninth nerve for taste. The trigeminal, as you said, is not for taste, it's for the general touch. Tamam?
Yeah, it's clear now. Thank you.
So nice. Like, do you guys have any questions for the first question, or is everything clear? يعني? You guys can write in the chat. I can re-explain if you want to. Here, تمام. طيب. After having a tonsillectomy, a 57-year-old man with long history of chewing tobacco use is unable to detect taste on the posterior one-third of his tongue. طيب, which of the following nerves has most likely been injured?
I think C, glossopharyngeal.
تمام. So صح. The answer is C. Just like I said, the posterior one-third is supplied by the glossopharyngeal. The anterior two-thirds, chorda tympani, which is part of the facial. تمام. Do you guys have any question? No? Is everything clear?
Clear.
تمام. So let's go to the third question. طيب. Wait, there's this. Can you guys see the picture here?
Yeah, we can see it.
Yes.
Okay, great. So a 45-year-old man goes to his physician complaining of having a trouble with his speech and involuntary contractions within his tongue. The doctor notes that his tongue deviates to the right when the patient attempts to protrude his tongue, as you can see in the figure. Yeah. So what nerve is most likely damaged in this patient?
Right hypoglossal.
Yeah.
B.
Okay, so why do you guys think it's the right hypoglossal nerve?
Okay, let's say that someone got punched really hard in his right side of the mandible, in which reside the hypoglossal.
Yeah.
So So the tongue would deviate to the affected side. Let's
Okay,
take it
صح.
in a car example.
Yeah. So what you're saying is correct. Um, so do you guys know what muscle the right hypoglossal nerve, the hypoglossal nerve innervates? What is it called? طبعا the answer is correct. It's B. It's B. Right hypoglossal. So there's this mnemonic that you guys can يعني احفظوها. It's you lick your wounds. تمام. So whenever the tongue is deviated to the right hypoglossal nerve is affected. If it's deviated to the left, it's the left hypoglossal nerve that is affected. So as you can see in this figure, um, so the hypoglossal nerve innervates the genioglossus muscle. Yeah, you lick your wounds. صح. So it innervates the genioglossus muscle. So if you have like a problem in the right, a lesion in your right hypoglossal nerve, you can't. So as you can see, this is a normal figure. The right and left nerves are intact. There's no problems. يعني كل شيء تمام. بس here the right hypoglossal nerve is في lesion. It's يعني not intact. So the genioglossus muscle here is not pushing عشان يكون medial. اللسان ما يكون medial. The left hypoglossal nerve is intact. It is supplying the left genioglossus muscle. So it's pushing the tongue to the right side. Do you guys understand this uh thing?
Yes.
Yeah, it's clear.
تمام. Should we go to the next question?
Yeah.
Hey, صح. So guys, I forgot to tell you. So for the muscles of the يعني tongue and the mouth and الفك الماstication وهي الأشياء, you guys are gonna need to know all of them and what nerves innervate them because in the exam he's gonna ask about those stuff. It's really important that you guys memorize the muscles and the nerves innervating them and the blood supply, صح? And the blood supply. It's really important. Dr. Hassan likes to ask about these questions. Like this question, this one, I remember seeing one in my final. It was somewhat like this question. تمام يلا بسم الله. Okay, this is an easy question. Let's go. It's Dr. Atif, not Hassan. It's not Dr. Hassan Sheba.
No, it was Dr. Hassan last year, but this year we have Dr. Atif for the lecture.
Oh, يعني إن شاء الله it's going to be the same questions. I don't think يعني he can't get يعني questions that are different. They're all يعني هم نفس الconcept, so it's the same questions. But as I told you guys, nerves و muscles and the nerves innervating them. تمام? And the blood supply. Okay? Is everything clear? طيب, this question. This is an easy question. So, which of the following structures is located in the vestibule of the oral cavity?
B.
Yeah, it
B.
is. So yeah, okay. It's B. But I wanna ask you guys a question. What is the difference between the vestibule and the proper the mouth proper or
الvestibule is in between the يعني in between the teeth and the يعني inner part of the lips.
the what? The teeth and the inner part of
No,
what?
it's in between the teeth and the inner part of the lip يعني I don't know how to explain.
So I think yeah, between the teeth and lips. So what you're saying is correct. تمام. Uh, so you can check this figure, but what separates the mouth, the uh oral mouth proper, I forgot what it's called, something mouth proper, I think. If you guys can,
I think you mean oral cavity proper.
Yeah, it's
yeah,
oral cavity proper.
yeah, oral cavity proper, sorry. So what separates the oral cavity proper and the vestibules are the teeth and the gum. تمام. So this is the vestibule. Can you guys see this? The green thing here. This is the vestibule. Okay, this is the vestibule. This is the oral cavity proper. So the parotid, the ما تقسم.
ما ادري
so the opening of
سيريوم
the parotid duct,
خلاص ما استخدم
uh,
ارميها.
yeah, okay. طيب the oh, okay, yeah, sure. Can you give me a minute, guys? I'm just trying to put the. So Reem, do you know how we can put the laser pointer?
I think just left click.
click شفت ال 3 lines اللي oh never mind point
Oh
your
yeah,
option
yeah, yeah.
later.
Okay. Oh, can you guys? Yeah. Okay. Thank you, guys.
Okay, we can see it now.
Okay, so can you guys see this area, those two areas?
Yes.
So those two areas are called the vestibules. They're separated from the oral cavity proper by the teeth and the gums. تمام? So as you can see here, طبعا the submandibular, sublingual, those ducts are in the oral cavity proper. As you can see here, in the vestibule, the parotid duct is in the vestibule. يعني it's still within this area. يعني it's not inside the oral cavity proper. تمام? I think it's an easy concept, صح? Do you guys need do you guys want me
I
to
think it's pretty clear.
I think it's pretty clear.
Okay, great. طيب, next question. So yeah, we're done with the first lecture. It's an easy lecture, الصراحة. Do you guys want me to explain anything, يعني? I can re-explain anything you guys want because it's like concepts are easy. Do you guys have any questions?
والله everything's clear.
Everything's clear, great. طيب, okay, so we're gonna start with the esophagus and stomach now. I want you guys to focus because those are the يعني most important two concepts in the يعني في ال GI anatomy اللي هو ال stomach وال esophagus. I mean most important lectures. So تمام. Let's start with the first question. A 60-year-old man comes to the comes to the physician, because of a 4-month history of difficulty swallowing and a 7 kg weight loss. تمام. A esophagogastrodiadonoscopy shows an exophytic mass in the distal third of the esophagus. Microscopic examination of biopsy specimen shows a well-differentiated adenocarcinoma. تمام. The patient is scheduled for surgical resection of the tumor. During the procedure, the surgeon damages a structure that passes through the diaphragm.
Vegas.
تمام. Okay. So what do you guys know the 3 openings of the
Yes, the cable opening at T8, the aortic hiatus at T12, and the esophageal hiatus on the T10.
Okay, so what are the structures that pass through the T8, the cable opening?
The inferior vena cava.
صح?
And in T12, it's the thoracic duct and the aorta. So C,
And
D,
D?
and B are eliminated. So
صح.
that just leaves us with the Vegas.
And what else? What also passes through T12? Aorta, thoracic duct, and
The esophagus, I think.
yes. Great. So the vagus nerve is the only one that passes through from these any options that passes through T10. As you can see, the caval opening transmits the IVC, and that's it. It's the IVC only. Then you have the esophageal opening, transmits the esophagus, right and left vagus nerve, and the esophageal branches of the left gastric vessels. Then you have T12, which transmits the ascending aorta, esophagus vein, and the thoracic ducts. Okay, I think it's a pretty straightforward question. صراحة. By the way, this question, يعني it's for this is I brought this question from Ambos. So if you see like, so it's an easy question, but as you can see, it's pretty scary, يعني because it's like too much words and stuff. But if you guys focus على إنه يعني دوروا على try to find the thing that it's trying to ask about. So you have to skip يعني بعض الأحيان يعني. Okay, so when you see a question in the exam, anatomy question, حاولوا تدوروا على the important things يعني. Skip. The surgeon damages a structure that passes through the diaphragm along with the esophagus at the level of the 10th thoracic vertebra. This is what's important. بعد when you يعني answer أو تحط the answer that you think is right, then read it all over again and you might find something important. But when you see a question that is this long, just try to find the important things that it tries to say. Okay? طيب, let's move on to the next question. طيب, a 43-year-old woman is admitted to the hospital because of deep abdominal pain in her epigastric region. On examination, it is observed that a retroperitoneal infection erodes an artery that runs along the superior border of the pancreas. Which of the splenic, okay, splenic, C. Okay, great. صح. طيب, do you know where the right gastric artery is, or where does it end?
The right gastric artery comes from the hepatic artery proper.
Okay, and where is it يعني situated? Where is it يعني?
It goes to the lesser curvature, to the right side of the stomach, not the greater curvature.
Yeah, صح. And what about the left gastroepiploic?
The left gastroepiploic is a branch of the splenic artery. It supplies the left part of the greater curvature of the stomach.
Okay, great. So just like your friend said, so طبعا the answer is splenic. As you can see, this is Dr. Vlad's يعني he drew this, and it's صراحة one of the best thing that يعني ما شاء الله, one of the best paintings I've ever seen. ما شاء الله يعني. So as you can see, this is the pancreas. This is the pancreas. I don't know if you can see it. Wait. So yeah, this is the pancreas. يعني ورا الstomach. It's posterior to the stomach, and this is the splenic artery. So it runs along the superior border of the pancreas, and it's called the splenic vein because artery because it supplies the spleen. طبعا why the right gastric artery is incorrect, because إنه يعني it supplies the stomach, or it is situated in the lesser curvature of the stomach. فيعني it's insignificant. And this is the right gastroepiploic, as you can see, the greater curvature. It has nothing to do with the superior border of the pancreas. طيب, let's go to the next question. Which artery supplies the lesser curvature of the stomach? If it was okay, let's just left gastric artery, صح. As we just said, the lesser curvature is supplied by two arteries, the left gastric artery and the left gastric artery and the right gastric artery. طبعا your friend has a question about okay, so this question. If it was asking about the head, we would say superior bacteria. Yeah, so if it says, so here it says along the superior border of the pancreas. But if it says the head of the pancreas, Yeah, I would say the superior bacteria شو اسمه the superior pancreatoduodenal artery because it supplies the head of the pancreas. Yeah. Is everything clear about this one? About this question?
clear.
So قلنا lesser curvature is supplied by two arteries, the left gastric artery and the right gastric artery. The greater curvature is supplied by two arteries. They are called the gastroepiploic and the left gastroepiploic and the right gastroepiploic. تمام? Just keep that in mind. This is a very important concept. I brought a lot of questions for the يعني blood supply of the stomach because it is the most important concept in the lecture. تمام? Guys, just if you can't يعني seem to memorize the arteries, you can watch Dr. Vlad's recording, 15th batch. He draws this the arteries and their branches and everything. So you guys, when you draw this, the arteries and what they supply along the stomach, it's gonna really help you guys. Please just keep in mind this is really important. Okay. Yeah, we just answered this. Okay, yeah, great. This is a nice question. Like, if there was a damage to the common hepatic artery, what two arteries supplying the stomach would be most effective?
B.
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 Yeah.
B. Okay.
Yes, B.
Okay. B. خلاص تمام. Great. It's طيب why isn't it A though? Why is it not A?
The
You guys-
left gastric is not a branch of the common hepatic. It's a direct branch of the celiac trunk. Whereas the right gastric, it's a branch of the proper hepatic artery. Well, the right gastroepiploic is a branch of the gastroduodenal, both of which are branches of the common hepatic. If that one gets damaged, both of these will get damaged as well.
Wallah, mashallah, great, nice explanation. طبعا what your friend says is completely true. As you can see, طبعا it says the common hepatic. As you can see here, this is the common hepatic. It's number 3. تمام? So if we cut the artery here, if we ligate it here, طيب, as we said, right gastric artery and the right gastroepiploic, يعني everything past number 3 is going to be affected. Number 4, proper hepatic, 7, 6, 8, which are the left hepatic, cystic, and the right hepatic and the cystic are all going to be affected. Number 9 is going to be affected. Everything past number 3 is going to be affected. تمام? Everything here is going to. Do you guys understand why it's B?
Yeah.
Do you guys have any questions? تمام. خلاص, let's move on. طيب, so I want someone to read this question.
I can read it.
Yeah, okay. Sure.
A 45-year-old man is brought to the emergency department because of severe abdominal pain for the past 2 hours. He has a 2-year history of burning epigastric pain that gets worse with meals. His pulse is 120 per minute, respirations are 22 per minute, and blood pressure is at 60/40 millimeters of mercury. Despite appropriate life-saving measures, he dies. And at autopsy, examination shows erosion of the right gastric artery, perforation of an ulcer in which of the following locations most likely caused this patient's findings. Do I answer the question as well?
So before answering, what do you think the important things are in this question are? Like what
The last
we
2
have-
sentences. It says erosion of the right gastric artery, but then it's asking where exactly did the ulcer happen that damaged this artery.
حلو, great. So what you said is completely correct. The last two sentences are important. Everything that okay, so this is important too, but يعني as يعني first year students, you just need to know those two information يعني those two sentences. This doesn't, I don't think it's significant for you guys. So yeah, that's why I told you guys you need to read يعني try and find what makes sense to you guys. بعدين try and يعني put an answer. بعدين read it all over again and see if it makes any difference. So what do you think the answer is?
The answer is most likely B, posterior duodenum.
Why do you think it's posterior duodenum?
Because the question is saying that there's an ulcer, or the damaged artery was the right gastric. So basically, it's asking what is the right gastric artery posterior to. That's going to be the شو اسمه.
The posterior, so this is your answer, posterior duodenum, because you think it's posterior.
Yeah.
طيب بس so in the question, so I like the way you're thinking, but no, in the question it doesn't say posterior. It says erosion of the right gastric artery. So the ulcer might,
Oh, okay.
yeah. So it's not posterior. The erosion, so يعني the ulcer, sorry, might be in the, where do you think now? Since it's not posterior.
The lesser curvature of the stomach.
صح. So the right gastric artery supplies the lesser curvature. تمام. طبعا I'm using this picture a lot because I really like this يعني picture that Dr. Vlad did. So as you can see, this is the right gastric artery that was eroded. تمام. So the ulcer is most likely in this area, the lesser curvature. It's most likely in this area, the lesser curvature.
Yeah.
بس يعني
If it was damage to the pancreatic duodenum, ولا gastroduodenal, then it would be posterior to the first part of the duodenum.
yes,
Right,
exactly.
مظبوط.
So yeah, that's why I was telling you that it did not say posterior, بس إنه it might فاهم قصدي إنه just take it simple عادي خلاص, just it said what is the question? So it said خلاص ulcer, just say إنه ulcer in that area. فهمت? Do you understand what I'm trying to say?
Yeah, I get what you're saying. Yeah.
That's all. Is everything clear, guys, in the chat? Do you guys want me to re-explain it? I can re-explain it if you guys want. So I'm just gonna re-explain it يعني briefly هيك. طيب قلنا so the important thing خلاص خلي هذولي, we don't need this. طيب at autopsy examination shows erosion of the right gastric artery. خلاص right gastric artery, now حطينا في مخنا right gastric artery في problem in that area. Wherever right gastric artery, احنا until now we don't know where the right gastric artery is. يعني تخيلوا انه we don't know. اللي لازم نحطه في مخنا, what we should know, انه wherever the right gastric artery is, there is a problem in that area. Okay? Whether it is posterior, whether it's greater curvature, lesser, wherever the right gastric artery is, there is a problem. Okay? So بعدين قال لك perforation of an ulcer in which of the following locations. Our second mission now, بعد ما عرفنا انه right gastric artery area is where the problem is. Now we need to know where the right gastric artery is. تمام. So now يعني لازم you guys should memorize where every artery is. So خلاص right gastric artery lesser curvature, so the ulcer is in the lesser curvature. It's just a question that exams يعني بيختبرك if you know where the location is. طيب I think that's it, that wraps that question. طيب so let's go to the next question. طيب because of an inflammatory bowel disease, which is called Crohn's disease, and a small obstruction leading to bowel ischemia, an elderly woman requires bypass of her ileum and jejunum and is scheduled for gastrocolostomy. Colostomy, I don't know how to say that بصراحة. The surgeon will ligate all arteries that send branches to the stomach. Which of the following arteries may be spared? C.
C.
C. Okay. C. طيب. Do you guys know why it's not the superior pancreatic duodenal artery?
Because the superior pancreatic duodenal is a branch of the gastroduodenal, which sends branches to the stomach.
Yes. So what you said is 100% correct, mashallah. It sends the superior pancreatic duodenal artery sends branches to the يعني the first part of the duodenal, or it's a part of the gastroduodenal. So it doesn't make sense in we ligate it. That's why it's the inferior pancreatic duodenal. As you can see here, this is the inferior pancreatic duodenal artery. There is no point of ligating it. يعني it supplies the duodenum. It has nothing to do with the stomach. That's why we spare the artery. We don't ligate it. Do you guys understand why? It's C. Do you guys have any questions?
I think it's clear.
No. No, you mean يعني no in no questions ولا no I don't understand? No questions. تمام. طيب. So we're done with this lecture. So I'm gonna tell you what you guys need to focus on. تمام. على السريع. This is the most important thing. تمام. You guys need to memorize this. This is really important. يعني the exam questions are going to be like around this يعني concept, the blood supply حق stomach. Like this makes like 80% of the questions for this lecture. You guys need to focus. عشان كذا جبت like 1, 2, 3. It's really important. And for the esophagus, you guys need to focus on these بعد the openings, because like they can bring a lot of questions. And yeah, that's it. تمام. You guys need to focus on the blood supply of the stomach. You guys need to focus on the blood supply of the stomach. It's really important. طيب, let's go to the peritoneum. I bet you guys like the peritoneum. Is it an easy concept for you guys?
It's probably the worst lecture for anatomy. صراحة يعني.
Yeah, الصراحة I can relate والله. ما ألومكم يعني. طيب, okay, let's start with an easy question. يعني هيك بسيط. Which of the following structures does not lie at least partially in the retroperitoneum? طيب,
C, the kidney.
I
Oh,
can see.
معليش no.
So what is your answer? Is it C or do you want to change it?
I'm going to change it.
So what is
So he's
your
asking, does not lie at least partially in the retroperitoneum, and he's asking which of these is intraperitoneal. Exactly. The adrenal gland, the duodenum, and the kidney, all of these are at least partially retroperitoneal. So the answer would be D, actually, explain.
طيب. So your answer is D, and we have 1B in the chat. So 1B, 1D. Okay, so let's see the answer. It's D. Do you guys understand the question in the chat? The guys who answered B, or because like it says does not lie at least partially in the retroperitoneum. So it's asking which one of these is intraperitoneal. It's like straightforward. Kidney is not intraperitoneal, it's retroperitoneal. The adrenal gland, which is called the suprarenal gland, is along with the kidney, so it's retroperitoneal too. The duodenum is يعني there is another question that I'm going to explain the duodenum. صراحة duodenum is complex because it's like as you can see, the first part of the duodenum is intraperitoneal, but the second and third part are retroperitoneal. So. بس إن صراحة it's my mistake إنه أنا I just wrote the duodenum. I should have. طيب خلاص just تخيلوا إنه ما في duodenum. So the guys in the chat, what if it was like not duodenum here? Do you guys think this? Do you know why spleen is D? خلاص, yeah, it's just pretty forward. So let me show you something. I want to explain the peritoneum على السريع بكل بساطة. So I want you guys to imagine that this is an organ, تمام? Okay. And this is the organ, this is the peritoneum. حلو. So the peritoneum, شايفين? The peritoneum, if it wraps all around the organ like this, it's going to be called intraperitoneal because it wraps all around it, تمام? So I think you guys see how it wraps all around the organ. Do you guys understand what I'm saying? What I'm trying to say?
Yeah, we get what you're saying. It's clear.
Hello. This is what? What is this?
This would be intraperitoneal.
Okay. So طيب, what if this was like pushed مثلا into a wall? يدي wall. Okay, my hand is a wall. So the organ is pushed to the wall, and peritoneum is doing this, just this.
This would be
This-
retroperitoneal.
This is retro, تمام? I don't know how to show you guys. It's like this. تمام? You guys understand the difference now? Because I'm going to show you in the you can see it here. So the organ is pushed into the wall, while peritoneum is not like fully يعني covering it. It's just covering it partially. But this is an intraperitoneal. It's covered from all sides. Shall I do the organ thing again? Will do you guys understand?
I think most people understand better.
Okay, great. Wait, let's go to the next question. Wait. A 35-year-old woman comes to a local hospital with abdominal tenderness and acute pain. On examination, her physician observes that an abdominal infection has spread retroperitoneally.
This one would be C.
Okay, so why is it not transverse colon?
Because the transverse colon is intraperitoneal. It has the transverse mesocolon that wraps around it. So we consider it a intraperitoneal organ or structure.
But what if I had ascending colon بدال transverse?
Ascending colon would also be correct. Yeah, because it's retroperitoneal. It's not entirely covered.
Yeah, صح. So شوفوا ascending is retroperitoneal. Transverse goes out شوي and it becomes intraperitoneal. It's covered from all sides. Descending is also retroperitoneal, just like the ascending. تمام? The spleen we just said it's intraperitoneal. حلو? And we said yeah, so I think you guys, do you guys have any questions? Or is it clear? It's pretty straightforward. يعني anatomy questions are always pretty straightforward. Clear, okay, great. So as you can see here, this is the ascending. It's retroperitoneal. This is intraperitoneal, and this is the descending, which is retroperitoneal. The rectum, however, يعني here, it's sorry, not the rectum, sorry, the sigmoid colon is intraperitoneal, just like the transverse colon. It's covered from all sides. The sigmoid colon, not the rectum. تمام? I made a mistake. I think it's clear, and it's pretty straightforward. Yeah. So guys, this thing helped me for يعني مع GI. This is one of the mnemonics that I found on the internet. It really helped me. So it is sad pucker. Hello. S is for suprarenal glands, which are the adrenal gland. Aorta and inferior vena cava are retroperitoneal يعني. And duodenum Just like I told you guys, the first part is intraperitoneal, the second and third segments are retroperitoneal. Then you have the pancreas, the ureters, sorry, the colon, the ascending and descending. So yeah, the colons here, just حطوا في بالكم, it's ascending and descending only, retroperitoneal. Then you have the K for kidneys, E for the esophagus, and R for the rectum. So what if I told you guys the sigmoid colon? What is it? Is it intra or retro?
Intraperitoneal.
Great. I think you guys get the hang of it now. Right, let's go to the next question. Let's proceed. So I want one of you guys to read this question. And is there anyone that wants to read it?
Should I read it?
Yeah, but I want you to read it as يعني in the way I told you to read it. Do you remember what I told you guys?
خلاص okay. يلا I'll immediately skip to the last sentence.
Okay.
Where in the peritoneal cavity would liquid most likely first collect when the patient is supine?
Hello.
This will be the rectouterine pouch of Douglas. Initially, I will put D, but then I'll go back to read the answer. Oh,
Hello.
لا ماشي. He's asking about supine يعني من
Supine, yeah.
تحت. It would be hepatorenal. Supine is إيه.
So
I'll go back to read the question now.
yeah, okay, great. Now you're
Yeah.
gonna read.
50-year-old female with long history of heartburn, self-treated with various over-the-counter medications, develops severe epigastric pain and is urgently admitted to the hospital. A gastroscopic examination reveals a small perforated ulceration in the posterior wall of the stomach body. At surgery, with the patient in supine position, 150 milliliters of blood-tinged frothy gray liquid is aspirated from the peritoneal cavity, where in the peritoneal cavity would liquid most likely first collect when the patient is supine.
تمام. So are you gonna change your answer ولا نفس الشيء?
لا, I think my answer is going to be the same.
So it's B.
Yes.
So your answer is correct. Hello, it's B. But what if I told you not يعني if ما حطيت supine? What if it was just يعني
If it was
it was
we're
like
in the
sitting,
peritoneal cavity,
yeah.
يعني I know when the patient is upright, it's going to collect in the rectouterine pouch.
صح. Yeah, it's correct. So when دايما when it says supine it's asking about the peritoneal يعني انه في liquid or something, it's always supine, always hepatorenal pouch of Morrison. Okay?
Yeah,
Supine
exactly.
pouch of Morrison. بس standing ولا انه sitting ولا some يعني in some questions they say 45 degrees. I don't know why, but I don't think they're gonna bring that in the questions. Final يعني. So when it's sitting or standing, it's rectouterine pouch, which is Douglas pouch. So as you can see, so you can wait, where is the? So yeah, this is the rectouterine pouch of Douglas. But when you're supine, it's not, the fluid is not going to accumulate here يعني. It's going to go here to the hepatorenal recess, طيب, which is called the Morrison's pouch. Okay, so this is this is this. تمام. The hepatorenal recess or the Morrison's pouch is situated between the liver and the right kidney. When you're supine, the fluid accumulates between the liver and the right kidney يعني. تمام.
تمام.
تمام. So do you guys have any question? If you don't mention D. Oh yeah. So yeah, if you don't mention supine, it's D. I think that's what you're saying, so normally it would be D because yeah, sure. صح. So for R, it's correct. What you're saying is correct. If you're standing or if I did not mention supine, it should be D. So let's see this question. A 43-year-old female accountant complains of severe epigastric pain and is admitted to the hospital. A gastroscopic examination reveals a small perforated ulceration in the posterior wall of the greater curvature of her stomach. An upright chest radiograph reveals a small amount of free air in the peritoneal cavity. Where is the air most likely located? طبعا some say D, but I just want you to يعني to focus on this word here, air. It's not liquid. So okay, so I'm gonna, so yeah, it's air, not water, or not liquid, يعني sorry, not. So what do you guys think the answer is?
Probably A, subphrenic.
Yeah. So it's the subphrenic space. Did you guys take the subphrenic space?
We didn't. I don't think the doctor really يعني ما دققت عليه.
Oh,
Yeah, it might
so
have
if you,
been mentioned in the slides, but it's not something important يعني.
okay, so sure, actually, because I checked your guys' slides, I did not see the same. So the answer is A. It's the subphrenic space. But when I checked the slides, I couldn't
Yeah,
find anything.
subphrenic space. Yeah, it wasn't in the slides. بس
Yeah,
يعني
but
from reading the question you can tell because subphrenic يعني تحت diaphragm يعني you can kind of.
exactly. Because I asked some of your guys' friends, first years, they told me they know what subphrenic is. So I just thought that I should mention.
عاد ما شاء الله يعني أنت سائل دوافير. Next time ask عامة الشعب.
Oh, sorry, I'm gonna. Into Darfur, so I'm not gonna ask you next time, inshallah. I'm just joking. MashaAllah. So I'm gonna explain it briefly. يعني ما تدرون, it may come, may not. I don't know. So the subphrenic space is a space between the diaphragm and the liver. Then when you have a air يعني uh, in your peritoneal cavity, it's most likely going to accumulate here in the either right subphrenic or left subphrenic. طيب, I think that I don't want to focus on this because you guys did not take it. يعني. There's no point of. Do you guys understand this concept, or do you just
The
want me to?
concept is clear, yeah. بس I think
Should I?
خلاص يعني.
I think I should go to the next question. I think you guys need to know this. I'm sorry. طيب. This is okay, before going answering this question. So someone was like saying it's air, not water. Yeah, so basically if it was water, it would have been different, but air is different, yeah. So okay, so let's go to the next question. طيب, a 25-year-old female is admitted to the hospital with sharp pain in the left lower quadrant. Patient history reveals that her last menstrual period was 10 days ago. Transvaginal ultrasound reveals a ruptured cyst on the left ovary. The sonogram also reveals approximately 100 ml of fluid in the pelvis, which is presumed to represent cyst contents and bleeding from the rupture site. Where is the fluid most likely located when standing? D. طيب. So you guys are correct. This is the same concept that I just explained like 2 questions ago. So as you can see, this is the rectum, this is the uterus, and this is the urethra. Okay. So here we have this area called the rectouterine pouch, or you can call it pouch of Douglas. Okay. So when you're standing, the fluid is always going to accumulate here, most likely. يعني. Okay, so when would it, okay, so a mental person. Okay, so let's leave it. So let's leave the omental bursa later because I have a question and I'm gonna explain it. Do you guys know what the lesser sac is?
Yeah.
Okay, so I'm gonna explain it when the question comes. But always when she's standing, it's going to be a rectouterine pouch. تمام. حلو. Now, طيب, let's go to the next question. Do you guys have any questions for the pouch of Douglas? Because it's easy. صراحة, I want to explain, but I think you guys, mashallah, get the hang of it. It's easy. Because I used to have problems with the pouches. So let's just proceed. طيب, a 55-year-old man was admitted to the hospital with severe abdominal pain. Gastroscopy and CT scan revealed a perforating ulcer in the posterior wall of the stomach. Where would the peritonitis most likely develop? So it says posterior wall of the stomach.
The answer is B.
Lesser sac is صح. So just like صراحة I wanted to explain it with this picture because this picture الصراحة summarizes everything you need to know about the mental person. So this is the stomach, تمام? This is the posterior wall of the stomach. حلو. So when we remove the stomach, you can see there's this like sac, I would say, or this place. It's called the lesser sac. تمام. This is the omental bursa. This is what they mean by omental bursa. So إذا صار عندك ulcer, if you have an ulcer here in the posterior wall of the stomach, you're gonna have peritonitis here in the lesser sac, omental bursa. You guys understand now why it's not Douglas pouch or hepatorenal recess?
Yeah, that's clear.
Like, do you guys know what Jason's pouch is?
We didn't take it.
Yeah, great. There's no such thing as Jason's pouch. So there. So let's just move on. طيب. A 24-year-old woman has a dull aching pain in the umbilical region and flexion of the hip against resistance. Do you guys know the sauce test?
No.
So there's this test. I'm going to show you guys how in the next slide. This test is used to يعني to detect something. So do you guys first of all صح, I'm just skipping. أنا ما بعرف ليش قاعد. I'm skipping. Do you guys know what the answer is for this question? So when she does the sauce test, she has a pain. What is the organ يعني? Or what is the structure? Sorry.
The appendix probably.
Yeah, so it's the appendix. So the sauce test صراحة أنا تحمست يعني. I wanted to explain the sauce test first. So the sauce test is طبعا do you guys know that the appendix is on the right side. So the appendix they do this test which is called the sauce test. They start to flex the sauce major muscle against resistance. لأنه السauce is posterior to the appendix, it starts irritating the appendix. لأنه because it's inflamed, so you're gonna have pain. So if you have a ruptured appendix, acute appendicitis, whenever the sauce muscle is flexed, it's gonna affect the appendix. يعني it's gonna push it or يعني irritate it. Do you guys understand now why
Yeah,
it was?
that's clear.
Okay, let's move on. I don't think. Do you guys have questions? Okay, let's move on to the next question. طيب. A 43-year-old man is admitted to the ER with complaints of intense abdominal pain. Radiographic examination revealed a right subphrenic abscess. طبعا you guys did not take this, but let's just try and answer it together. That extends to the midline. Which of the following structures would most likely be in a position to retard the spread of the abscess across the midline? So I'm just gonna try and explain this with like so this is the subphrenic space. It's like right here, tamam. So it's, let's say it's on the right side. It says the right subphrenic abscess. So what ligament? What ligament? You guys took the ligament, I think. The ligaments of the, like the coronary, the falciform, the round ligament. So what stops the يعني abscess to extend to the midline?
It would
So you
be
have,
D. Yeah.
it would be D.
I think so. لأن الحين what he's asking is that there's a right subphrenic recess which going to the midline. لا Gastroduodenal is on the left actually. It wouldn't be
Okay, حلو. Nice thinking. I say C. Why not C? طيب, between the diaphragm. No, but there is this ligament, a ligament that is like on the anterior side that stops طيب, down the midline.
yeah, maybe it
So
would be
I'm just gonna explain
falciform
now.
ligament.
So I'm gonna explain it on the picture better يعني أحسن. So it's B, it's falciform ligament. It's not coronary ligament. So this is the coronary ligament. It attaches the liver to the diaphragm superiorly. حلو. So this هنا, this, all of this. يا سلام, تمام. Great. So this is the falciform ligament. شايفين? So if let's say it's on the right side, subphrenic, it's the thing that is stopping it from going to the midline and the left side is the falciform ligament. It's not the coronary. Coronary just attaches the liver to the superior يعني border اللي هو diaphragm, attaches this liver to the diaphragm. Do you guys understand now why it's relevant? يعني why يعني it's correct, the falciform? Because you guys are taking the ligaments. That's why I brought this question. Is it clear? Do you guys have any questions before we move on?
You made it clear.
Sure.
وضحتها يعني.
So I'm done with my part. So if you guys have any question, stomach, peritoneum, abdominal wall, anything, I can answer it right now. Like, don't miss the opportunity. I can answer anything before we start the next part. Because no, it's any question regarding the ligaments, even يعني حتى لو I did not bring a question about it, you guys can ask. It's okay, and I can explain. I think everything's clear. طبعا يعني ما شاء الله, you guys are smart, and you answered everything correctly. So the exam questions are not يعني it's not different than these questions. I don't think يعني they can create more يعني new questions, because like هذولي, those questions I brought them from books, and some of them are from the AMBOS question شو اسمه custom USMLE bank, sorry. So this is questions that are طيب guys, I think we're done with the first part. If you guys want to take a 5-minute break, do you guys want to take a 5-minute break, or should we proceed على طول?
Let us take a 5 minute break نصلي العصر.
تمام. خلاص, okay.
Uh,
خلاص, you guys can take the break. So we're gonna stop here. I want them to be back. So guys, this is 9. Can you guys like So 4:15. I think 4:15 is good. So how about we start the second part at 4:15? Do you guys think it's enough?
تمام man, ما عندي مانع.
خلاص 4:15 we're gonna start the second part with my friend Faisal. And I hope everything is clear. And inshallah يعني في آخر slide there is my number if you guys have any question. And yeah, so see you guys later.
So, Assalamu alaikum. I'm Faisal Alkhwaiter, and inshallah I'll be continuing on the practice questions. I also want to thank Abdullah for the amazing job he did. Inshallah, we cover some of his greatness على قولتهم. So, let's start. I'm going to start with small intestine. I'm going to go in order. So, let's start with the first question. So, a patient with a penetrating ulcer of the posterior abdominal wall at the first part of the duodenum, which blood vessel is subjected to erosion?
B gastroduodenum.
That's right. So, different here, the duodenum. So the duodenum is just an extension after the stomach. So it's the third, it's the first part of the three parts of the small intestine. What we're concerned, so we have our stomach here, which we removed to be able to visualize the whole duodenum and the pancreas. As you can see here, we have our pylorus, which continues on the first part of the duodenum. So we saw the relations to the duodenum in its four parts. So the duodenum is made up of four parts: first, second, third, and then fourth, which continues then as the jejunum. So starting with the first part, we do have anterior. My voice is clear, right? Lagging pretty hardly. Hello?
Yes,
we can hear
everything is
you.
clear.
Okay, perfect. Let's go on. So as I heard you, if you want me to take some time before answering the questions, sure. طيب, let's take this one. Let me open the chat. Okay, a 74-year-old patient was diagnosed with a tumor located in the head of the pancreas. This tumor could block which structure? The chat just disappeared. Let me check. So everyone's saying C. Perfect. That is the right answer. So let's go back to the pancreas right now. So just to orient you, just a second, let me move the chat. So as you can see here, this is our pancreas made up of four parts: head, neck, body, and then tail. This is the main pancreatic duct. It will go on and then it attaches here with the common bile duct. And there's what we have here is the major duodenal papilla, and we'll have the hepatoduodenal papilla ampulla, which is also the ampulla of Vader, where the pancreatic juices and the bile would mix up here with the in the duodenum, so it helps in some properties of digestion. Is that clear?
Yes, it's clear.
Next one. I know my piece is a bit fast, but the concepts here are pretty easy. If you have any questions, don't feel to stop me. Stop me anytime. I'll explain everything. Okay. A 45-year-old female is admitted to the hospital with symptoms of an upper bowel obstruction. Upon CT examination, it is found that the transverse version of the duodenum is compressed by a large vessel. Which of the following vessels most likely would be causing this compression? So as I mentioned in the first question in the relations, I mentioned an important vessel. So it is B. It is a superior mesenteric artery. Let's talk more about it. So after, I think Abdullah explained the celiac trunk very well, and as Abdullah mentioned, Dr. Vlad's video is amazing. I highly recommend you watch it because he draws it piece by piece, and it makes everything makes sense. So let's talk about the superior mesenteric artery. It protrudes from the abdominal aorta at the level of L1 and gives us a lot of branches. They're not tough. They're any common sense. So as you can see, it comes out and then it gives one branch up to the pancreas and supplies some part of the pancreas. So it's the inferior pancreatic duodenal and the lower part of the duodenum. And then you'll have the jejunal and ileal branches. They will go there and make these shapes, which are called arcades, or they're like rings, which help in the blood supply. And then it goes here and terminates to some colic branches. So you have anterior and posterior colic branches. And then we do have the appendicular artery. The appendix is a very significant structure here clinically. We'll get into it in the next couple of questions. And they'll give us right and middle colic. We're missing the left colic, right? Can anyone tell me where does the left colic come from?
The left colic is a
inferior.
referent of the inferior mesenteric artery.
The IMA. We'll be touching upon that inshallah in the next few questions. So please, blood supply is really, really important, really significant. Make sure that you relay every point of the blood supply to the organ. That's how I understand it. So I imagine the blood supply and the organ itself, how does it move? And you'll be able to answer any question. And one important skill, I think the first semester should have taught you, is how to read answers the right way, how to highlight the clinical points. So you'll see some questions that are 5-6 lines long. They'll tell you Muhammad is a 40-year-old man. He has 3 kids. He was divorced 17 times. That's not what really matters in the sense of this question. So if you're doing green, why would that be very important? You'll understand it inshallah soon. So it will save you time, and it's a nice skill to get. So let's move into the next question. A 34-year-old man is undergoing an emergency appendectomy. After the appendectomy was performed successfully, the patient undergoes an exploratory laparoscopy. Which of the following anatomic features are most useful in distinguishing between the jejunum and the ileum from the ileum? I forgot to say, I apologize for my voice. I'm a bit sick, but inshallah everything will be clear. Yes, you're true. It is B. So I have this nice drawing. You have our superior mesenteric artery, which we just mentioned. We have our arcades, and then we'll have some of the features that distinguish these both. For me, the most prominent feature was the fat, the visceral fat. Excuse me just a second. Sorry for that. And the amount of blood vessels, as you can see here, the ileum is quite, the arcades are quite shorter, and and then you have some histological features. I think in the OSPE review they'll talk about them. And yeah, so let's go to the next question. Yeah, is there any problems with the small intestine?
That's great, thank you.
Yeah, welcome. Yalla, bismillah. Large intestine. So let's go. A 47-year-old male was scheduled for the appendectomy. During the open operative procedure, it was discovered that an atypical embryologic rotation of the intestine adhesions and adipose tissue made into somewhat difficult of the appendix. Most commonly, the vermiform appendix is best located by locating and tracing which of the following. I know it's the question is filled with medical jargon, but this is what matters to us. And yeah, it is D. So now we're going to the large intestine. There are some prominent features. As you can see here, you have the tinea coli, which is a band of longitudinal muscle. And then you have the holstra, which is very, very important. It provides the look of the segmented part of the GI, and it helps in the peristaltic, in the movements of digested food. I think this is the movements of the GI was covered in physio pretty well. It's really good to relay that anatomically. Okay, great. And yeah, we'll be diving a lot more in the appendix because it's a very, very important clinical significant case, and it's pretty high yield. Let me not talk about that much and answer the next question. So we have a 7-year-old woman admitted to the emergency department with high fever, nausea, vomiting. Physical examination revealed increased abdominal pain in the para-umbilical region and rebound tenderness over McBurney's point. Blood test showed marked leukocyte or leukocytosis. Which of the following is most likely the likely diagnosis? So what can we take from as clinical features? So young, 7-year-old, fever, and a high white blood cell count, and most importantly, tenderness over McBurney's sign. So yes, it is appendicitis. So let's dive more. So appendicitis is the inflammation of the appendix itself. So you have a lot of lymphoid tissue here. It could be obstructed and it can cause inflammation. It's one of the most common surgical operations that people do because the only way to usually, the most common way to treat appendicitis is by acute appendicitis is by the removal. It's characterized by lower right quadrant pain in McBurney's point. So let me tell you how to identify McBurney's point very easily. I think there are YouTube videos that are 30 seconds long and explain it perfectly. So you have our umbilicus here, then you have our anterior superior iliac spine. 2/3 of the way down here, it's the McBurney's point. As soon as you apply some pressure, there would be tenderness and might be some rebounding. The patient would do this because of the pain. And as Abdullah explained before, you have the psoas sign. Oh, you can't see me. Oh, my bad. I think hopefully you can see me now. So we have our umbilicus here, and I was explaining with my hands a lot, but hard like maybe next time. The umbilicus is here, and then we have our anterior superior iliac spine. And of course, it's all in the right side. And then 2/3 of the way, you'll find McBurney's point. As soon as you apply a significant amount of pressure, the patient would rebound. Some people don't. It depends on your pain tolerance. And they would feel tenderness at that point. So, and then you have a lot more tests. You have you can't just say, okay, that's it. We do have the psoas tests. We do have a lot of ways to confirm it, but McBurney's point is one of the most well-known. I want to remove my camera, but yeah, this is good enough. Let's go. Next question. Any questions about appendicitis? Please be careful. It's pretty high yield, and not now in life in general. Okay, a 65-year-old woman comes to the emergency department because of sudden onset of severe abdominal pain, nausea, and vomiting for the past 2 hours. Her pulse rate is, as you see, the question is very long. You'll see what's significant to us. So the pulse rate is 110, blood pressure was 141/98, abdominal examination showed diffuse stomach pain, blah, 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 blah. A CT angiogram of the abdominal wall confers an occlusion in the inferior mesenteric artery. Which of the following structures in the GI tract most likely affected in this patient? Yes, I know I take forever to read the question, but it's descending colon. So let's see why. Firstly, let's eliminate some of the answers. Why isn't it not A, ascending colon?
Right
because
colic,
the
right colic.
Okay, SMA. Why isn't it lower rectal?
lower rectum is
It's
supplied
part of
by
the internal branch of the internal iliac or internal pudendal.
Yeah, somewhere تحت ما له دخل.
Yeah, somewhere تحت.
Yes, and then you'll get it in the repro, inshallah. Next block, لاحقين خير. And then stomach, that's pretty easy. Celiac trunk. So it is descending colon. So let's talk about the inferior mesenteric artery. So as you can see here, remember the superior mesenteric artery stops at 2/3 of the transverse colon. So it covers everything else, starting from the lower part of the duodenum up to here. And now we do have the inferior mesenteric artery. So it starts at, I think, L3, L4. It says here L3. And then you have 3 segments: left colic, sigmoidal. Left colic is all the way here. And then you have sigmoidal, and then superior rectal. As you said, inferior rectal is going to be from the branches of the pudendal nerve, pudendal artery, my bad. And yeah, that's some of the most important. And then they do have anastomoses, but they're not any quite significant here. You have some the marginal artery of German, and I do have faint memories of that, but just know the most important significant part about the IMA. Everything's clear? Okay,
Yes, everything's clear.
let's move on. I left these golden slides to you. Those cover most of what you have right now. As I said here, you have three parts. Usually characterize them in your head. You have foregut, midgut, and hindgut. Those usually correlate with the blood supply. So embryo is very important in GI. Please, do you have any? It's pretty significant in GI. You can relate to it throughout pathologically from the diverticulum and so on. And don't forget the sympathetic and parasympathetic sensory the autonomic supply. It's pretty important. It's very easy, can be easily put on the question and can be a key to answering a question. So just touch upon this table. It's a good way to revise it. And where does usually pain refer to? So last but not least, we have a liver and biliary apparatus. Most of the liver and biliary apparatus will be touched upon in the OSPE review. We're talking about any lobes, caudate, right, left, any histologically. Today I want to focus on one certain concept, which is blood supply. During a laparoscopic cholecystectomy, on a 61-year-old male, which of the following arteries must be clamped to remove the gallbladder safely?
C.
خلينا نشوف الشات ثواني. Yes, it is C. So C is the cystic artery, which is a branch of
The right hepatic.
MashaAllah عليك. Yes, it is the branch of the right hepatic. That's pretty significant here. لما تشوفوا how does the biliary apparatus go? It gets supplied من هنا. The celiac trunk should be anywhere around here. I'm trying to imagine it. And then it merges out here with the pancreatic duct, and they provide the ampulla of Valor. For the next question, which is very important, during a scheduled laparoscopic cholecystectomy on a 47-year-old female patient, the resident accidentally clamped the hepatoduodenal ligament instead of the cystic artery, which is the following vessels most likely to be occluded in this injury.
B, the proper hepatic.
Proper hepatic.
I want to know who said D. Why would you say it's D? طيب. Yes. But it is D. No, it is our favorite triangle of Callot, which has, as you can see here, the hepatoduodenal junction. It has the branches of the La ilaha illallah, right hepatic. As soon as it ligated. Sorry, my bad. It's B. I don't know why is it. It is common. It is right hepatic. My bad. لأنه right hepatic is if you have خل نرجع. I'll go back a lot of slides just to make sure إنه I'm right. لأنه I might be, as you can see here. Yeah, celiac trunk goes as common hepatic. It's usually it's in the hepatoduodenal recess, so it should be. Wait, let me double check. I don't want to provide the wrong. Probably there's a problem في الchoices. لأنه as you can see here, ثواني, it says in the hepatoduodenal ligament, which the triangle of Callot is where is هنا. I'll double check and أكد لكم. I apologize for that. I think probably it is B, but
Yeah, I think the correct answer is B, but there might have been an
I think
issue.
Yeah, it's B.
yeah, it's probably
it's
B.
B.
لأنه هذيك لسه تونا. I'll double check and send it. So that would be it for me. Thank you very much. Again, I apologize for the last slide. واضح الزكوة مأثرة شوي بس إن شاء الله you benefited. Last words. GI is was a very enjoyable block for me personally. It was tough at some points. Sure. What's the question? والله يعني I'm not sure how to يعني how to say this in the most exam would be similar if not easier, and these are USMLE. Those are close to USMLE level. Most of them are from books. ف it would be إن شاء الله easier. The questions would be يعني shorter لأنه إحنا حاطين لك 17 paragraph في question. That's what you should prep for. بس the questions would be يعني more يعني clinically based, بس it would be direct. الانسر يعني should be clear. Yeah, exactly. If you know the concept خلاص يعني حرفيا as soon as sure, if there's a question I can answer, or you can there is Abdullah's number here or email, you can send it to him. If I can answer the question I will, but my peritoneal expertise are a bit rusty. If there's the question about that, I might not be the best answer. But if something I'd help with, I'd love to. Please don't forget to scan the code and give us your honest opinion. That would be very much appreciated. We wish we can improve to better help you alongside this year and in future years. Again, my Abdullah's and my number are open 24/7 if questions related to this past session or any other subjects. Any other questions? If you want to, you can send it to him or myself. I'll be able to answer it inshallah. ما أبغى أطول عليكم. Thank you so much, and that's it for me, and have a great day. Good luck with your final. Inshallah you'll ace it.
Thank you, Faisal. Thank you, Abdullah.
حق واجب.